Welcome to today's update, where the cases around the world are growing really quite quickly now in many parts of the world. So a quick review this morning, and in order, the countries I want to look at are United States, Brazil, India, Germany, Mexico, Australia, Iran, Afghanistan and the UK, just looking at those briefly. Now, the global situation is this is the 24-hour increase. Globally, we've got 237,000 new cases in a 24-hour period, so well up over 14 million now. Deaths 600,000. And the biggest increases are currently occurring in the United States, Brazil, India and South Africa. And if we just look at that in graphic form now, so these are adjusted per capita, these are cases per million. So we see South Africa, the United States, Brazil, Mexico and India. So South Africa and the United States and Brazil, unfortunately, with the most cases at the present time. Now, the World Health Organization, I was watching the last briefing by Dr. Tedros and I was trying to make some notes on it, but didn't actually say very much, so I was struggling a bit really. But he did say a few things. That he said 4 pillars are essential to the response: strong and humble leadership, community engagement, suppressing transmission and saving lives as being the key. And I thought that was a good summary actually. So think about it where you live. Don't care what country you're in. Have you had strong and humble leadership? You see, good leaders are humble. They lead by example. I've worked for many leaders, as I'm sure you have, over work and non-work careers. And the best leaders lead by example. They're humble. Have our leaders been humble? Have our leaders been strong? Not always, I'm afraid. Community engagement, we've brought this up so many times from people with different countries. Do the people understand what is required? Are the people with us? Is everyone moving together? Is the community engagement? Well, some countries I can think of, there hasn't been community engagement. And the result of these things aren't met is we get more transmission. And we save less lives, unfortunately. So I thought that was actually quite useful from the World Health Organization there. Now, the United States, cases on Thursday increasing by 77,000. Cases on Friday increasing by 70,000 and Saturday 65,000. Now, it does look like a bit of a downward trend there, but I don't think it is. Unfortunately, the cases in the United States are dramatically increasing. And if you go on to I won't do it now, but go onto the CDC website there, and you can hover over your state and see what's going on. This link is in the description, and it gives you a lot of additional information. And the rate of growth is quite substantial, unfortunately. But it's got it all broken down by state, so there's just a map there. Hover over your state and look at it. Deaths have been over 900 per day for the past 4 days in the United States. Many places we could mention, but Florida increasing cases, 92,000 cases in the past week. Some medical facilities in Houston reported to be 104%. So unfortunately, in the United States there is accelerated growth, and it's in some northern states now as well as predominantly in the south and western states. So unfortunately, the exponential growth in the United States is taking place now. Medical facilities are already under strain, and unfortunately it's going to get worse over the next few weeks. It's not really an optimistic day today, I'm afraid. Now, Brazil, a very challenged healthcare infrastructure, of course. The cases have been over 40,000 per day for quite a few days now. So over 2 million cases now officially in Brazil. Deaths 78,000. We know the real number's higher. Now, I get criticised for saying that, but I have seen films of people working, especially in rural areas. And the other thing I don't know about Brazil, so in rural areas, the the cases are not often properly attributed to COVID, even if they are COVID related. And I don't know in Brazil how accurate the data is collected in the poorer areas, in the slum areas. Not very, I suspect. But regardless of the precise numbers, we know that the pandemic is basically, I don't like to use the word out of control, but accelerating in Brazil. Many governors and mayors have loosened restrictions in the past few weeks for economic reasons. The leaders are saying we have still not reached the peak in Brazil. A bit of time to go yet, even though things are bad as they are, because of successive epidemics occurring in various regions. So what we're getting in Brazil now is initially there was a lot in the big cities, Rio de Janeiro, Sao Paulo, but now it's diffusing out, and particularly now the pandemic is spreading to southern Brazil, spreading to interior, more rural areas where there's an older population. And of course, it's wintertime down there now. It's cold, and it's cold with humidity, which isn't helping. So we're seeing cases spreading all over Brazil now, including the south of Brazil. Now, India. I've been concerned about India for a long time because many of the living conditions in India for hundreds of millions of people are very challenging. Many people living in perhaps one small room. Now, India's got a population of about 1.3 billion. It's just a huge population. But still, there's about 600 million people, getting on for half of that population, live in severe poverty. So there's 600 or 700 million people in India in severe poverty, and the disease is going to spread amongst those very rapidly and to everyone because of the living conditions. So I've been worried about India for a long time, and unfortunately it's starting to happen now. So the official cases are over 1 million. They're saying the number's expected to double to 2 million by the 10th of August, is what the Indian authorities are currently estimating. So a doubling the number of cases in the next few weeks. Infection spreading to more rural areas. We did look at a particularly badly affected state, Bihar, one of the poorer states up near the Nepali border, as being badly affected and locked down, causing severe economic difficulties as well. So infections are spreading. Deaths in India still relatively low at 26,000. That will be increasing. Local governments reimposing focused lockdowns. So like we're seeing in other parts of the world, like Bihar is a focused lockdown. So this kind of idea of smart lockdowns, locking down areas when the number of cases in a particular area rises, because we can't lock everywhere down. It's just not economically practicable. Germany, found quite a few more cases in Germany. That surprised me, 529. Up to 200,000 now, according to the Robert Koch Institute. So cases certainly not going away in Germany. It's kind of like the UK, really. These figures are similar. We have suppressed the disease in Germany and the UK, but it hasn't gone away. It's still there. And as restrictions are loosened, cases will start to increase again, unfortunately. It has not gone away. Mexico, another country of concern. Again, very poor infrastructure in many parts of Mexico. It's going to be difficult to treat a lot of the poorly people in Mexico as the infection spreads. Already 38,000 deaths in Mexico. A third of a million cases officially diagnosed. Now, Australia, relatively low number of cases so far, 11,000 and 122 deaths. So, but Friday there was an extra 428 cases, and Saturday an extra 217 cases. So this is largely driven by this outbreak in Melbourne. So over 11,000 cases now altogether in Australia, 122 deaths. So this outbreak is a problem. So what's being done about it? Well, quite a lot, I'm pleased to say. Now, Victoria. This has come from the government websites in Victoria. Directions will be updated to send a clear message. So this looks good. Remember these criteria for government that we talked about? which I can't find now. But anyway, the criteria for government: strong and humble leadership. So it looks like the leadership here is being strong. I'm hopeful it'll also be humble as well. A clear message. So the population needs to come along with us. That's the essential thing. This needs to be done together. Community engagement. We're facing a pandemic, and this is not a time for parties. What's actually been what this comment on is people have been organising weddings in rural Victoria outside Melbourne because of the restrictions in Melbourne, and the government are clamping down on this. This includes travel to regional Victoria to attend weddings or other parties. So looking like strong leadership there. You know, I've personally known two couples, I'm sure many of you have, who have got married during this lockdown period. Of course, they stream it online. The wedding is going ahead. I mean, I think if young people, any people decide they want to get married, if they're sure about it, they should just get on with it and do it. So people have been getting married, two couples in my experience. And they've put it online. They've distributed food and drinks to people who can watch online. And they'll just have a party when they can. You know, marriage is a public declaration, and you can still do that, you know. We don't need to spend lots and lots of money and time on wedding services, really. Have a party afterwards. Now, transmission drivers in Melbourne. Now, the epidemiologists in Melbourne are saying there's a decrease in the number of cases spreading between families, which is good. The majority of outbreaks now, the driver of transmission now, is work. The majority of outbreaks are people working closely together. So it seems to be work-based drivers of transmission at the moment in Melbourne. So inspectors are going to enforce a blitz to be carried out on workplaces across the state for things like the hygiene wearing, the mask wearing. So this is going to be enforced. This is strong leadership. And if everyone understands why this is being done, that also meets the criteria of community engagement. Aged care and healthcare settings, transmission remains high. So they are aware that care facilities are a risk factor here, and there's still transmission in those, and they are supplying the appropriate equipment and training to help with that. From the 22nd of July, visitation will be restricted to those identified as carers. So restricted visiting, unfortunately, is going to be necessary as well. Now, masks in the Melbourne area, and again, the leadership is quite clear here. From midnight on Wednesday the 22nd, it's mandated. So this couple of days gives time to buy or make a mask, which is reasonable. In England, we announced this in England ages ago, for the 24th of July in England, so they're acting much quicker in Melbourne than we are in the UK. If you already have one, please start wearing it now. If you don't have a mask, a scarf is better than nothing. As with everything, this shouldn't be about looking for loopholes. Community engagement. It's about each of us doing something small to keep everyone around us safe. Wearing masks is primarily to keep those around us safe. And in the workplace, as we see in Melbourne, that is going to be enforced, which is good. Now, I actually think I've listened quite a bit over the past few days to the leaders and the epidemiologists and the doctors in Melbourne and roundabout, and they do seem to be on top of this. I'm actually cautiously optimistic that this outbreak could be suppressed. Cautiously optimistic. I'm not saying we can make the virus go away, but I really do believe they can suppress this because they have strong government, hopefully humble leadership, and community engagement and enforcement. And I'm mildly optimistic about that situation. Let's hope I'm right about that. Now, Iran. Official number of cases, official number of deaths. But President Rouhani says 25 million people are currently infected. He says this wasn't Rouhani actually, this was someone else. Those who have encountered the virus have achieved complete immunity. Let's hope they know something we don't, if that's true. I suspect it's likely to be at least partly true, but that's good. But the government is saying there's still no herd immunity. and they're expecting 35 million more cases in the next few months. 35 million cases in the next few months, as the country prepares itself to double the number of people that are being hospitalised. So what are the Iranian authorities saying here? So the president's saying there's 25 million people currently infected. He's saying those who've encountered the virus have achieved complete immunity. Then he's saying there's still no herd immunity. And he expects 35 million more to be infected in the next few months. It seems clear, putting these things together, the Iranian government is going for a herd immunity strategy. It seems clear that's what they're doing. And they're expecting more hospital admissions, so they're preparing for that. The country prepare itself for double the number of hospitalisations. So while they haven't actually said we are going for a herd immunity strategy, this is very much what it looks like to me. So this means there'll be exponential growth in Iran over the next month or two. It means the majority of the population will catch the virus. 25 million people already have it, 35 million expected. That means 60 million people. They're expecting 60 million people to be infected in Iran. And to cope with that, they're doubling the number, country prepare for double the number of hospitalisations. Well, it's going to be way more than double the number of hospitalisations. So with this strategy, if 60 million people are infected and 1% die, that means we can expect 600,000 deaths in Iran over the course of this year, if this is what the Iranian government is doing, as it appears to be. But the problem is, this means that many, many tens of thousands of people are going to be critically ill all at the same time. And there is no way the health services, even though they're preparing for double the number of hospitalisations, are going to be able to cope with this. To me, that means the death rate in Iran could easily be 2%. That would be 1.2 million people. I don't want to consider 3 or 4%. 4% would be 2.4 million people. But these numbers aren't absurd, because we know that about 5% of people get critically ill and depend on medical care in order to survive. So this is really a remarkably dangerous and concerning strategy, and we'll continue to watch it with interest. But from the information that's there, it looks patently likely to me that the government is going for this herd immunity strategy. Now, the good side of this is that probably means that by January 2021, there'll be no new cases in Iran. The people there will be almost certainly immune. Might not be the complete immunity that they're talking about, but there will be a high degree of immunity, I believe. The Iranian authorities certainly seem to believe that, although the science of that is not yet conclusive. But it means we could be looking at 500,000 to 2 million deaths in Iran. I'm just sort of letting the import of what they're doing kind of soak in there. It really is quite incredible if that's the strategy that they're pursuing. It will become clearer in time, but it looks like it. Now, Afghanistan, still in that part of the world. Population of Afghanistan is 37 million, and in a 24-hour period they only had 60 new cases, bringing the total number of cases up to 35,000. Of course, this is pure fiction, because for the whole country, for 37 million people, in a 24-hour period, 194 tests were carried out. Right, that is just incredible. The country of Afghanistan, that's been the attention of so much international military attention, media attention, where, I don't know, am I exaggerating? $1 trillion have been spent. Thousands and thousands of young lives have been expended. I know my son certainly knows people that have been killed in Afghanistan of his generation. And now we just seem to be saying, okay, never mind. I don't know. It's complicated. Just the irony, though, to me seems just so incredible that we've spent $1 trillion or something. Thousands and thousands of young lives have been lost from the UK, mostly from the United States, from other countries. And now, as a result of all this high-tech Western intervention, Afghanistan, for a population of 37 million, is able to organise 194 tests in a 24-hour period. The UK, more on the UK in the next video. Now, the cases in the UK, that's the official number, just under 300,000. The Office for National Statistics says it's 2.8 million. And the deaths are 45,000. But in the next video, we'll look at the reason that might be a little bit high. Because what's been happening in the UK, actually, is they've been noting whether someone has been diagnosed as positive and then counting them as a COVID-19 death, whether they were died of COVID-19 or fell off a cliff or something. So the numbers might be going down a bit. And if they do go down a bit, that's good, because that means the case fatality rate will also be reduced, which could be encouraging. So where are we at? Well, disease largely suppressed in quite a few countries, westernised countries, but not gone away, not by any means, not by any means gone away. As we're taking the brakes off in the UK and Europe, there will be an increase in cases, but I'm hopeful it's going to be at a manageable level. I'm hopeful for that. But other parts of the world exponentially increase in cases. Iran particularly concerning, where they seem to be going for this herd immunity strategy. They have not got the health facilities to be able to cope with that. That means a lot of people could potentially die. And the outbreak in Australia, which is being actively managed. Pity it got that far. We looked at the debacle with the so-called security guards who were not behaving appropriately. But having made that mistake, the Australian authorities are now responding quite superbly. But globally, we're going to carry on seeing an increase in cases for the next month, for the next few months.